Measles has spread in major parts of Aden Governorate, infecting a great number of children. Despite the efforts done by the medical staff at Al Sadaqa Hospital to contain it, the cases are increasing dramatically. This report has more details.
The displacement of the citizen Yahya from Hajjah to Aden was not the only problem burdening him and his family. Yahya had other sufferings as his 10-year-old son was in a Sadaqa General Hospital suffering from the deadly disease of measles, which deteriorated his health and his body.
I came to Aden because of the war and we arrived at Al Basatin. I tried to look for a job, but unfortunately I couldn't find any, and I have 7 girls and 3 boys. I couldn't afford a living for them, so I started to look for any other jobs like car washing. Before Ramadan, my son got measles and I immediately went to hospitals and clinics. They asked for money, but I couldn't afford to pay, so his health deteriorated. Then I moved him here to As-Sadaqa.
The case of Yahya's son is not the only one, but there are hundreds of children affected by this dangerous disease, which recently spread again.
My son suffers from measles and high fever, and I ask authorities to provide medicines, as a lot of children suffer from measles. The number of patients suffering from measles has increased, and we couldn't provide for them extra beds because the cases keep increasing and each room has from 2 to 3 beds only.
The spread of measles in Aden and the neighboring governorates is threatening the lives of children amid the inability of public health centers to play their medical role and the role of private hospitals from receiving sick cases, which increases the number of injuries and deaths at the same time.
Measles is a virus that is easily spread. It is spread through breathing. If the patient coughs, the virus then starts to spread. The hospital, as you saw, is on full capacity, and we are very affected that we can't do anything for these patients, to the point that some kids are on the floor because there is no more beds to receive the patients. The problem is not insufficient medicines alone, but also the lack of staff and lack of number of beds.
The absence of vaccination and vaccination campaigns against measles and the lack of social awareness of its seriousness, as well as the scarcity of available health capabilities, constitute an epidemic disaster that is difficult to recover. Health authorities are required to activate their role to save the lives of children and save the medical sector, which is experiencing an unprecedented setback and deterioration.